We really think this is going to be a really good and informative meeting today. It's critical, like all of our meetings, but to hear from our community health workers is really an important step in how we move forward. You can advance to the next slide. So we'll start out the meeting as we always do, by making sure that we know who we're working with and enjoying, but basically coming together as a team, as a collective. So I am going to, I am so bad about doing this kind of thing. So I'm going to hand it over to Caitlin, at least for this little part, to make sure that, new people get introduced and I don't miss anybody.
Sure thing. So good morning, everybody. I am Caitlin Murphy from the Prince George's County Health Department, and I would love to have anyone who is returning, who has been to CCCT before, to put their name and organization in the chat. And then if you're new, this is your first ever CCCT meeting, if you could just come off of mute and introduce yourself.
My name is Deborah. I'm sorry.
Good morning, everyone. My name is Miriam. I'm new. So this is my first time attending this kind of meeting.
Awesome. Well, welcome. What organization are you with?
HCDI.
Awesome. Welcome, Miriam.
Thank you.
Hello, my name is Chelsea, and I'm a community health worker with HCDI under the CHIEF program. And this is my first time joining the meeting.
Awesome. We're glad you're here, Chelsea. Welcome.
Thank you. Hi, everyone. This is Tina. This is my first time attending this meeting. I'm from HCDI under the CHIEF program.
Hi, Tina. Welcome.
Thank you.
Anybody else? Go ahead, Deborah.
My name is Deborah Collier with the Prince George's County Health Department. This is my first time attending the meeting as well.
Awesome. Welcome. And I see, I just saw in the chat that Wendy Bailey from Delaware Public Health. That's awesome. We have our neighboring state here. So welcome, Wendy. All right. Well, thank you so much, everyone who introduced yourself, and welcome to all our new folks. Could you go to the next slide, Taylor?
So I just want to go over the agenda really quickly. One is that we want to be sure that we welcome everyone to the meeting and make sure you all get very comfortable with us because we have a lot of work to do this year. We look forward to making sure that we work together as a collective and we get some workable outcomes from what we're doing here. So today we're going to have a panel discussion about community health worker workflow, and then have hopefully a robust discussion around how we can identify the trends that different folks use so that we can start thinking about how we can standardize and collect information so we can evaluate how to optimize the workflows and make it better for community health workers overall. Then we'll have some announcements and we'll talk about what we're going to, the next meeting. Go to the next slide, please. Now, the mission and vision, we always put this up so everybody can see and read and understand our mission and vision. The most important thing, though, is that our overall drive is the drive that why everybody comes to this meeting is because we want to improve healthcare of people who need help. And we know they need help. We don't need to do a research study and come back with a lot of information and say, these people need help. We know people need help. And those people who need help, we have to find ways to help them that will not only improve their quality of care, but allow our health system to function with the processes that we do, meaning that costs can be reimbursed, that the system will work well for them and it can be incorporated into our health system. And that's our goal. We want to make sure that we understand how we can best help people who need help. This is the most important work in the healthcare system that people can do, even though it may not be the most recognized, but it is the most important. Because if you can't help, if we do things and we can't get people help that need help, our system will continuously not be able to help them. So our CCCT is going to find how to do that and do that well. That's our goal. We're all driven by that, and we're going to do that. Go to the next slide, please. So I'm going to turn it over to Caitlin, and she will take the meeting from here. Caitlin?
Thanks, Dr. Carter. So
You're
I
on mute.
know, am I? I'm not.
No, we can
Can
hear
you
her.
hear me? Okay.
Yeah, we can hear you, Caitlin.
Okay, got it. Yes, so we wanted to just highlight for you all the goals and strategies that we're working on here in CCCT. And of course, this is related to our community health improvement plan that Kim and the coalition itself has been working very hard on. We want to remain focused on what it is we're trying to do here. So we had two main goals come out of our brainstorming sessions. The first one is related to identifying community health resources and then improving connectivity to them. So, for example, making sure that when a community health worker encounters someone with a need for, say, food, they're able to know what the available resources for food are and connect them with the right one. So we know that that's an issue. We have identified some strategy steps here. The first being to select a community resource inventory. So that's why we had, if you'll remember, I think maybe not the last session, but the session before that, we had 211 come speak as an option for a CRI that is purchased, of course, at the state level that we would like to build out at the county level. Strategy 2 being invest in ensuring the CRI is comprehensive and accurately reflects resources in Prince George's County. Strategy 3, implementing the CRI in community health workers' workflows. And then, of course, always advocating to address gaps, because when we have a better sense of our inventory of resources in the county, we'll better be able to quantify the lack of resources in certain areas, which we all feel strongly. And then the second goal that we've identified is promoting data sharing between partners. We haven't kind of gotten to build that one out quite as far, but I think some initial conversations have started, so I'm sure we'll talk more about that in the future. Could you go to the next slide, Taylor? Thank you. So the idea behind today is we really wanted to hear from community health workers directly. So we know that CHWs are out every day experiencing these issues and want to make sure that we build an approach collectively that works to solve those problems. So we have a panel today for you all of community health workers in a range of different types of organizations, hospital systems, CBOs, governments, HCDI, different partners. And we'll be looking to understand what the current tools and resources that they're using are, and then thinking through what might be necessary and helpful for a community resource inventory, and then establishing those standards across the board for care coordination. So without further ado, I will introduce our panelists. I'm thinking of the best way to do this. Maybe we can call organization by organization and then have the CHWs who are present on the panel introduce themselves. Okay, so I will start with CASA.
Hello, everyone. My name is Liz, and unfortunately, my CHWs are out in the field right now, so they would not be able to attend. but I am here. And so the easiest when we give resources out, we use the link on Bertha. Because it just makes it a little bit easier for them to insert the zip code of where that community member lives and be able to give resources within a mile radius, depending if they have public transportation or if they have their own vehicle, then they can tailor the resources to that. The other thing that we have is we have volunteers that are some RCHWs, but they're known as promotoras de salud, which is CHW in Spanish. And they attend a lot of different fairs. They get flyers. They use WhatsApp to share a lot of their flyers and stuff like that. And so they, my team is also included in that WhatsApp. So they are able to send out text messages with the flyers if they pertain to the area where the community member might live at or is close enough to where they can get to that resource. Those are the big, two big ways that that we are able to assist our community members in the event that there's something out of the ordinary, like we had one community member, just as an example, needed resources for a funeral for her child, and things like that come to me, and then I do a nationwide search, sort of say, and we were able to get this community member connected, oddly enough, to a foundation in Texas where they were able to grant them some funds to be able to bury their child. So those are the things that that our community health workers do.
Thanks for that, Liz. I am going to turn next to HCDI. HCDI, could your community health workers, would you mind just introducing yourselves real quickly? And then we'll turn to a list of questions, specific questions that we prepared for the panel.
If anyone is talking, they are on mute. So if everyone could just take yourself off mute and introduce yourself again as a CHW so we know who will be answering the questions upcoming.
Yes, my name is Miriam. So what we do is that they send
Oh, sorry,
some.
Miriam, I'm going to interrupt you real quick. So just say your name
Okay.
and then we're going to go into the questions in a bit. So
Oh,
just
okay.
Miriam's
Okay.
perfect. Yep.
Okay. My name is Miriam.
Thanks, Miriam.
Hi, my name is Tracy.
Hey, Tracy, thanks.
Hi, my name is Tina.
Awesome. Thank you, Tina. Is that everyone from HCDI?
My name is Chelsea.
Great. Thanks, Chelsea. How about from the health department? Do we have any health department CHWs on this morning?
Hello, good morning. I'm Denise, and I am with the health department.
Hey, Denise, good to see you. All right. How about from CCI? And
Hi, I'm
CCI.
Giselle. I'm also a CHW.
Oh,
from the
I'm
health
sorry,
department.
Giselle. I didn't see you. Good to see
No,
you.
you're okay.
Anyone from CCI? Is that Ali? Okay, we'll go on to MedStar.
Hi, good morning. My name is Preston, and I am the team lead here at MedStar Southern Maryland Hospital.
Awesome. Thank you. All right, so I think I'll turn it over to Liz to facilitate the panel itself. We'll kick it off with our questions.
All right, so thank you again, everyone, for joining us today and echoing what Dr. Carter said at the beginning, that how you guys are all such a vital part of our healthcare system and don't always necessarily get the recognition that you deserve. So we're just gonna wanna get your input on these various questions. So if you could either physically raise your hand and be on camera so I know who to call on, or use the raised hand function on Teams. That way we can ensure that everyone has an opportunity to share their experiences. All right. So the first question is, what is your organization's process for connecting residents to resources? Yes, MedStar, sorry. Your name cut off on my screen, I apologize.
Oh, no worries. My name is Preston, yes. So we have a new process that we're piloting at the moment for the new CMS regulations that have started. So as patients are admitted through our ED, or they've come in for a scheduled surgery, they go through, we have a SDOH screening that they answer. Based on the score that they receive, they are sent through to case management, and case management goes through and decides whether or not they need to be sent a referral down to our CHA team. And then our CHA team will contact the patients once they've been discharged.
Thank you so much. All right, so I see Giselle's hand raised, if you would like to speak next.
Yeah, so I am the community health worker. I work with the health department, but currently they have me here in a location at the University of Maryland Capital Region Hospital. So what their process is here at the hospital that they made is the RNs, when they are intaked either into the emergency or on different floors of the hospital, the RNs are in charge of filing the SDOH and asking the assessment to the patients. Once they flag for a disparity or an insecurity, that's when the case managers and I would get the notification of the disparity or what they're lacking in. And that's when I would look at the resources that are available for that patient and due to their zip code and where they're currently living. And that's when I would go up to their room and speak further with them on how we can assist them.
Thank you, Giselle. Ali, I saw you had your hand raised earlier. Did you want to add something? All right. Is there anyone else from any of the other organizations who would like to share their process for connecting residents to resources? If so, if you could either just physically raise your hand or use the raise hand function. It'll be nice to hear from someone from HCDI, as I know there are many of you on here.
Can you hear me? This is Dan.
Yes, we can hear you, Dan.
Okay, great. Well, I'm HCDI. I'm a community health worker, and my main thrust is in the Hispanic community, and there's many of them that have solicited some kind of help regarding rent assistance, health insurance, food stamps, food, physical food. And it's interesting because I get to talk to them, ask them questions, and then I lead them into the closest place where they can go and get assistance. For example, one of the hubs is in Langley Park, and most of my uh, constituents are from the Prince George's County. So they go there, they appreciate that, and they get assisted there with whatever situation they have, even legal assistance with landlords, stuff like that, Medicaid and food stamps. So it's interesting because I get to meet a lot of people on the phone and so on. And sometimes it's even quicker for me now. Instead of asking them to get a pencil and paper, I'll go ahead and I said, I'll send you a text right after this conversation with the information you need to have. And it's good because they have it already on the phone. They don't have to look for a pencil. And I send them a message. It was good talking to you. And here's the place you need to go on this days at this time so you can get the assistance for what you requested for. So it's good to help people that way.
Great, thank you, Dan. Liz, I know that you mentioned CASA uses Aunt Bertha, and then also your volunteers connect via WhatsApp. Any other processes that CASA uses? Liz Torres, sorry.
Yes, no, thank you. Unfortunately, I'm on my phone and it does not allow me to show video at this time. But thank you for asking me. At this time, those are the two best resources that we use is the Aunt Bertha. Aunt Bertha also has the text feature where you can literally send them a text just by entering their phone. And it will, again, just like Dan iterated, they can receive their resources right to their phone. And with the WhatsApp, we just send them the flyer as well if the location is within reach for the community member.
Let me ask a quick follow-up question, Liz, related to Bertha. Are you all do you like pay to have the enterprise version of that, or are you just using like the web application?
We just use the free we just use the free free services. I did have, and this was prior to us having the CHWs when I first started a little over 3 years ago, when I was actually introduced to Aunt Bertha. We did have a meeting with them, and the resources are pretty much the same as far as not the resources, the way to use the application. So CASA decided just to stick with the free version, and they do guarantee that they have a team in place that checks their resources. If not every week, it's every other week.
Thanks. And Jay put in the chat that Aunt Bertha has changed to findhelp.org in case anyone was getting confused about the name it's currently under. So thank you, Jay, for that. Any other follow-up questions from the group before we go to proceed to the next question? All right. So I know we've already heard about using Find Help / Aunt Bertha for keeping track of available organizations. Would anyone else from the CHW panel be willing to share how internally their organizations keep track of what resources are available? Yes, Preston.
So how within our department we have a CHA toolkit that we are constantly updating, constantly adding resources, taking off resources once we find out if they're no longer available. And we also, each CHA on my team has their own way of keeping their resources organized as well. Some of us just keep them in our brains. Some of us have a full notebook full of all the information possible, or we have a digital like personal toolkit that we use. But one of the big projects that we have taken on this past year has been updating and refining our toolkit so that if we do add people to the team, if people leave, we're able to send them that toolkit if they're unfamiliar with the available resources.
Thank you. Any other organization would like to share how they keep track of what resources are available? Anyone from the health department?
I know that we have a document, like a Word document shared drive where we all can open it up and share it amongst each other. We update it and it has a different list of like the most used resources. Like
That's a good one right there. Yep. A shared folder is great.
All right, so what I'm hearing from the various organizations is that kind of internally being responsible for maintaining what resources are available and either having our own personal system or a share file amongst the team. Anyone from the group have any questions for the CHWs regarding that?
I do. I saw your hand was up. I'm curious how the hospital does it.
So currently here, for me, from my understanding, I'm the only community health worker at the hospital. So what I do is it's based to like a day-to-day basis. I try to reuse the same resources to see if it's available to the patients, but when I look into the resources, I do a day-to-day check if it's still available. Like currently, previously, the emergency rental assistance program was closed or full at capacity, and they weren't taking any new applications, only the existing applications. But yesterday, when I rechecked to see if it was open, it's now accepting new applications once again. So it's just a day-to-day type of basis. I'm looking at what resources I have and if they're open or if they closed their status.
I have a question for Ms. Calustra. Can you hear me?
Yes, I can.
If you don't mind me asking, which hospital is the one that you serve that perhaps you can see?
Yeah, the University of Maryland Capital Region Hospital.
Okay, thanks a lot. Is it okay we contact you sometime? You can fax us some.
Yeah, that's okay.
Okay, I appreciate that. Thank you, ma'am.
No problem.
Kelly, I know you put in a resource for SDOH in the chat. Would you mind just sharing a little more information about that link that you provided?
Sure. It will take you to it's a 4-page table that lists community search resources. It then lists in the second column website, and the third column gives you a little more information about that particular organization. So the Social Care Network, which is findhelp.org, and Elder Care Locator are two that are in here. But then it's divided into financial assistance, health insurance coverage, unemployment assistance, food access, transportation, and these are national, so that many of them you go in and you can actually type in your location and it will give you maybe things that aren't listed in other places. There's also a link for mental health, for utility assistance, for homelessness and housing, the safety in the home, and family caregiver support links. So it's electronic. You all can just download it and use it as you see fit.
Oh, thanks, Jay, about the additional information regarding you reaching out to findhelp.org. That would be wonderful. Any other questions or concerns or follow-up items before we transition to the next question? All right. So for the CHWs, how would your work benefit from a standardized process for connecting people to services and resources? So we're hearing how all the different organizations have their own internal process. Thinking about if there is a standardized process throughout the county, how do you think that could benefit your work? Or would it not benefit your work? Let's follow on the other side. Yes, Preston.
So currently, as I mentioned earlier, we are still in the pilot program for the CMS regulations. I really think once we've got those ironed out and we're no longer in the pilot program, I think it'll really improve our reach with the patients that we serve in the community. And I think once everyone is kind of understanding, because I know like our nurses, admitting nurses do the SDOH screening, it's new for them. Once people start being more comfortable, understanding why they're doing what they're doing, I think it'll really help iron out some of the kinks that we've been seeing.
Thank you. Giselle, I see your hands raised.
Yeah, just like Preston, they did just start implementing the nurses taking the SDOH for the patients recently, like this month. So it's still a learning process for them and for everyone on the team, for the medical staff. But I feel as though with some of the current questions that are on the SDOH, it does misconstrue a little bit on how the process works, due to just a lot of misinformation just getting around to the patients and with what we directly serve and assist with.
Could you provide an example or expand on that of how it could be misleading?
So one of the at least for over here, one of the SDOH questions that they ask the patients is if in the last 12 months that if they were in an unstable housing environment, unstable housing environment, or have been in a shelter in the past 12 months. And if they answer yes, then that's when they're flagged for housing assistance, at least on my system. Even if they answer to the other two previous questions on saying that yes, they do have housing and yes, they are able to financially, they don't have no financial hardships on paying rent or mortgage. So once I speak with the patient, since they do flag on my screen on housing assistance, due to them just saying yes to that one question, that's when they deny needing housing assistance or needing any other assistance within that realm. So just like it just elongates the process on like how many SDOH patients I have.
Thank you. And so I really appreciate hearing from Giselle and Preston from the hospital side, how it could benefit. It'll be from the other organizations that are outside of the hospital system. How could you see a standardized process benefiting how you're providing services? Yes, Denise.
It can also like improve the efficiency and ensure consistency in the services that we are delivering, and it can help track the outcomes and the measures of the effectiveness of the interventions.
Thank you. And Jay, your hand was next.
Yeah, thanks. We're in the process of building a comprehensive by name list of everybody experiencing homelessness in Prince George's County as a part of our work with Built for Zero and system improvements that we're doing across homeless services. I think any efforts to standardize identification of people who are experiencing homelessness, like comes up in the social determinants of health, is going to make it easier for us to do that, and that's going to have a direct impact on our ability to ask for funding, make sure that our interventions for emergency housing and for longer term housing options like transitional housing and permanent supportive housing, as well as medical respite beds, safe haven beds, things like that we don't yet have in Prince George's County, is going to be easier if we can have a comprehensive understanding of the scope of the problem.
Definitely. And Liz Torres, I saw that your hand was raised.
So, yes, thank you. Yes, I believe that having a service in place like that would be amazing. However, the biggest barrier that we have found just with using different services is that a lot of times the language, even if the person you're speaking with does speak the native tongue of Spanish or French, since that's the community that we serve. However, the resources when they get to the community member is not in Spanish or French. And so that presents a big barrier because then we get the call and we have to spend time translating the information. Or if they contact the resource, the person on the other line does not speak the language as well. So that once again creates a barrier.
Yeah, thank you for raising that issue regarding the challenges of the residents when there is a resource to be connected to, being able to access it in their preferred language.
Absolutely. Thank you.
Any additional comments, questions, or follow-up items before we transition to the next question?
Yes, I just wanted to ask Preston, when she refers to the CMS regulations that they are doing a pilot for, I just wanted to make sure that if you could put that in the chat, what that regulation is, because I don't know if everybody knows that.
Sure, absolutely.
Okay.
I will find a good link to I think it's the Center for Medicare and Medicaid Services, and I will put that in the chat for you all.
Thank you so much. All right, so moving right along, just being mindful of our time. So what are your organization's challenges with connecting residents to resources in Prince George's County? So just kind of enlighten the group what I know Liz just mentioned, the barriers in terms of resources being available in preferred languages. What other barriers are you guys all coming across on a day-to-day basis? Yes, Tracy. Tracy, then Denise, then Dan. Tracy, sorry, I thought you had your hand raised.
I did. I'm sorry. Something's going on with the system. Thank you for calling my name. And some challenging, what I found challenging connecting resources to some residents are like when I come across a resource that depending on the resident circumstance and I connect them to the resource, as a community health worker, I'm supposed to just refer them to the resource and then jump out of it and have them call. But I do provide extra because a lot of the residents come back and say that some of the resources that they was connected to either they had a really bad experience. Some of them come back really emotional, crying. And as a community health worker, you know what I'm saying? I want to find out what happened. I want to know what is the bottom problem. So I will reach out to that entity and I will call and find out what was the problem, what was the issue. So what I notice is when you connect the residents to the resources, they're more comfortable having a community health worker or a social worker call with them to these organizations so that organization know that they are connected to another entity and that someone is backing them up. So a lot of time when they go on their own asking for whatever the situation is, a lot of them came back to me and saying stuff about, for one example, I want to use this one as a really good example. I have many examples and a lot of emails. So a lot of them, one of example was just 2 weeks ago. It was a young lady. She had kids. She was on a Section 8 for about 12 13 years. In that 12, 13 years, circumstances changed. She only had one child during that time. Certain situation changes in 12 and 13 years. So her application, which she applied for housing, only had one child. Now that she reached out to the community health worker, and the community health worker called and found out why she on Section 8 on the waiting list for 9 years. What is the problem? What is the holdup? We just want to have answers. So the organization said, okay, come to us and we're going to come and make an appointment. You can come to us. When the young lady went to the organization, someone in there was so rude and was like, why you have all these kids? Why you keep having all these kids if this is happening to you? And woo, woo, woo. It was just so much going on. The person was so emotional, came back crying to me. I had to call the head department of that organization. Eventually, at the end of all of this, because of the communication between the CHW, the organization, and the resident was able to get a house for her family and her children. But it was a fight. We had to get to the bottom of the core. And that's what I do. I get to the bottom of the core of why this is happening. If the person is meant to, if the person, like the guy before me, I forgot his name, the one, it was the guy who just made a comment about homelessness. And he was right on point. I really agree with you. We do need to have a mental assessment with everyone who wants to participate in these programs, so we can know the core of the issue of every resident, every patient, or everyone. Because when they go on their own looking for resources, it's not the same as they go with a community health worker and a CHW social worker. So, and I noticed another challenging for me, I noticed that as a community health worker, I love the community. I love serving the people. But another challenging thing for me also oh Lord, lost my thought. Is
I mean, Tracy, you have shared so much valuable information. Thank you so much for bringing up how, you know, as a CHW, even though if there is a resource provided, you have to advocate for
yes,
the residents, and that, you know, just providing, unfortunately, a way to access a resource doesn't necessarily enable them to do so, as their organization might not have the best customer service, or the resident themselves might not be able to communicate their needs. So thank you so much for sharing those stories, and also just great work of, you know, getting to the bottom, like
and
you
then not,
said.
and then one more challenging thing I
Mhm.
noticed for CHWs, this is a very important job, like the doctor said. This is the core for the social workers and everybody else to find out what we can do. So what I noticed is, as a community health worker, depending on your love for this job, you might go over the limit, and you might have to do some social work involving this job. And people, when they come to this office, I work in Health Connection. When they come to this office, they think I'm a social worker, and I
Mhm.
clearly have to let them know, you know what I'm saying? I'm not a social worker, I'm a community health worker, and this is my limit. But I don't want to be, they're all going through something. And
Mhm.
some people are can take into somebody and feel like, I can work better with this person. I need this person to do this. Plus, I'm bilingual. So a lot of
Mhm.
people come to me and they appreciate the fact that I speak Spanish and I'm able to call these places with them. And you know what I'm saying? But sometimes when you call these places, it turns into into a 5-hour project. You know what I'm saying?
Mhm.
Instead of a 45 minutes, because according to the CHW guidelines, we're supposed to have a 45 minutes with each parent, but it doesn't go that way at all. Every
Mhm.
situation is different. Every situation is a delicate. I call all of them delicate
Mhm.
situation.
Mhm. Yeah.
So that's another situation that I'm facing. How these residents look at CHWs more than a CHW. And not only that, when we call these different organizations, like for me, since I'm bilingual, a lot of them don't have translators or interpreters.
Mhm.
And I noticed that I also do also translate when they need translation, which I don't mind. That's what I'm there to do. But that is another thing, because you know what I'm saying, we do have barriers now, but
Right.
I try to, you know what I'm saying, stick with it. But sometimes it's just it over exceed our work protocol for a CHW. So that's just some little things I would like to share. And thank you, Liz.
Thank you so much, Tracy. That was very valuable on the ground insight. Much appreciated. So I know that Denise also had her hand raised. So if you would still like to share out or share something that Tracy didn't touch on, please do.
I thank you for giving me the time to talk. I just wanted to say that some of the challenges that I've noticed has been like the stigma with us seeking for help. And even though we do have the language line, some patients still don't feel comfortable with using it sometimes. So language barriers, and that's all I had to say.
Thank you, Denise. Yeah, that's a common theme that keeps coming up, the language barrier for our residents. I know, Dan, you also had a comment to share, and then going in order, then Giselle would be next.
Yeah, our challenges and interesting, and thank you, Ms. Tracy. That was a beautiful testimony. You're doing a lot. Uh, I learn daily more things. How can I help people? My challenge will be the fact that, most of the constituents that I contact, they are not, I hate to use the word illegal, but they're not documented. Let's put it that way, nicely. It's fine because we're here to serve them. And they're very hesitant to give any information, very hesitant, because they think that you're from the government. And I keep telling them this is an organization that it gets subsidized by the government to help people like you and so on. But they, I would say a good 20% of the phone numbers that I get there, that they get disconnected because they change numbers kind of often. And that's a challenge because they have a need, but how do I know I can get it? This is the phone number and so on. And to let the powers to be that being bilingual is a commodity. And those of you of us who speak Spanish, we are happy to do it, but I'm sure that the organizations realize that. But that's at least one of the challenges.
Thank you, Dan. And Giselle, thank you for being patient.
Thank you. So at least for me, a lot of challenges I face are just housing in general and getting undocumented patients like resources and assisting their needs, because most organizations, agencies do require them to have like an ID or some form of like a work visa, but there's a good amount of patients that are here that work under the table, that like only get paid through like cash and things like that. So unfortunately, there's not really a variety of options we can provide for them here. And yeah, just housing is like a really big one that I try to assist individuals with. Trying, like, there was a couple of times where I had to reach out and try to get information from to get the Section 8 housing vouchers, to get assistance from the HUD offices. I would always email, call, and still currently I have not received any reply or information back from those agencies. And this was in the beginning of March that I reached out to them.
Thank you.
Okay.
Thank you. Wait 1 second, Dan. Thank you, Giselle, so much for sharing that insight. And we we only have about 9 minutes left, and I know we have some more questions, so we'll try to get those in quickly. All right, so we already talked about using Aunt Bertha or findhelp.org. Quickly, quickly, did anyone have any experience with using 211 that they would like to share?
Yeah, I just provided the resources for them, but I would use 211 mainly for utility assistance or energy assistance.
Got it. Anyone else want to, oh yes, Tracy.
Oh, 211 is what I use. I've never heard of Aunt Bertha before. So that's new to me, and I would do my research on Aunt Bertha. This is my first time even seeing the word.
Yeah. So it's called findhelp.org now, Tracy. So you might have seen that, but it's no longer called Aunt Bertha.
Oh, yes, I do
Yeah,
work
yeah.
with Find Help. Okay,
Yeah,
thank you.
of course. Also, so again, just trying to speed through these last ones. How do your organizations keep track of if a referral was successful? Or how do you know if a person was able to access the service or not? And would it be helpful if there was a way to track the success of referrals? Tracy, your hand was first, so please. You're on mute if you're talking, Tracy.
Just muted.
Okay, my apologies.
No
The only
problem.
thing, like I said earlier, I do, when something successful happen, we have success stories, I do ask the residents to write emails sharing the experience with me is the CHIS program /CHW. I want them to just say, what was the experience they got out of the program CHIS, and what is the experience they got out of the CHW. So it's two different experiences, the experience through the CHIS program and through the CHWs. So when they share their emails, I will forward the emails to the supervisor, the project coordinator.
Wonderful. Thank you, Tracy. Anyone else want to share how your organization tracks success of referrals? And also on the flip side, would it be helpful to do that? To know when you refer a client, if they were able to access it, and if the resource is still available. Yes, Preston.
I think in a perfect world, we'd be able to consistently track and be able to keep up with contacting patients and clients after we've closed their case. We have 4 CHWs on our team now, but with caseloads, any person can have 30 to 40 clients a month. And so being able to follow up with those is kind of a daunting task. We do our best. Yeah. We try our best to be able to stay with the client until they have successfully gotten into whatever program or organization they're trying to work with. But then we also have guidelines for like protocols for our hospital system too, about limits of how long we can keep a case open. So it does prove some challenges because I know there's wait lists and we can't keep a case open for a year while the client waits to be admitted. So that's one of the challenges that we have.
Thank you for sharing that. And just in the interest of time, I'm going to wrap up. And so again, echoing what Dr. Carter said at the beginning, just thank you all so much for what you do. And we realize how it is not the most celebrated part of the healthcare system, but from all your experiences, what you shared, you guys really are such a vital part, and we really do appreciate you guys taking time out of your day to let us know what it is like as we transition into trying to build more structure regarding care coordination. So this was valuable insight, and just again, thank you all for your participation. And I'm going to turn it over to Caitlin for a community announcement so we can try to get it in the last 4 minutes.
Yeah, absolutely. Oh my goodness, excuse me. Does anyone have any announcements for everyone on the call? Anything exciting going on? Anything you want to share?
This is Kelly. I don't mean to interrupt. I put 3 Spanish resources in the chat. So if they want to click on links, they were for how to check your blood pressure, tobacco cessation, and naloxone saves lives. So you're welcome to use the links, print them, use them however. And we do quarterly discussion groups called links, LINKS. It's a CMS term. It stands for local interactive knowledge. Local interactive network of knowledge sharers. Only CMS could come up with that. But this one is due April the 11th, and we're looking for a community health worker. I sent you this information, Caitlin, that would be comfortable coming to just have a conversation about how medication questions are answered or assisted to answer by community health workers. So if you have someone that you're dealing with that's on medications, fresh out of the hospital, and they have questions about their medication, how is it that the community health workers handle that? There's no slides required. It's just a conversation, and you have about 4 or 5 minutes to speak on it. So again, that's April the 11th. If you have anyone who's interested in doing that, even if it's one of the CHW directors, that would be great. And lastly, we have some resources in Spanish on pneumonia immunizations, mostly pneumonia, flu, and COVID, I think are the 3 that we have done, but they are 2-minute videos. So can you all utilize those if I send you the links? That's it.
Thank you, sir.
Thanks, Kelly. Awesome. Does anyone else have any community announcements? All right, well, remember that our next coalition meeting, our next CCCT meeting is on Thursday, April 25th from 11 to noon, same time as today, and virtual again. So we would love for everyone to come. This was such a great discussion. I just want to echo what Liz said, that we're just very grateful for all the CHWs who shared their experiences today. And Dr. Carter, did you have any words you wanted to close us out with?
No, I'm just thankful for all of the folks that are on the call, and we will summarize this and we will take it to the next step. So thank you guys so much for being here.
Yeah, thanks so much, everyone. Have a great day. We'll see you next month.
Thank you.
Bye-bye.
Good day.
Thank you.
Bye-bye.
Bye-bye.
Bye.